Hello everyone, I'm Emily, one of the technicians at Kopec Veterinary. Today I'm going to demonstrate our new fecal system processing unit and a little bit about why we do fecal testing here. So we recently updated to the parasite system, and the reason we did that is because it has two advantages over the system we've been using before. The first one being that it takes only 3 minutes from start to finish to run a sample, versus our old system which took approximately 15 minutes to run just one fecal sample. The other reason that we're now using the parasite system is because we are able to actually capture an image of your horse's fecal sample, and this image will show the parasite ova or eggs that are seen within the sample itself, and that will be sent to you in an email so you're able to see what that looks like and what we're seeing on your horse's fecal sample. So I'm just going to quickly go over what we need from you in order to run the best sample here. So we would like if you can submit one complete fecal ball that is less than 12 hours old, so the fresher is better. If you're able to label that with your horse's name, your last name, and the date it was collected, that would be perfect. If you're not able to get that sample to us within the 12-hour time frame, we do ask that you would put it in the refrigerator so it can stay as fresh as possible. So over here at the parasite system, we have our processing unit, our imaging unit, and then our iPad with you, the client's information in it. So this here is my fecal sample cup, and I have it filled up to the line right here with regular tap water. Over here is our depressor and sample cup, and you can see that I have put the fecal sample in it up to the line right here so it's flush with the line. So I'm going to go ahead and start running the sample. I'm going to secure this depressor down onto the fecal cup. And once it's secure, I'm just going to depress this plunger a few times and then gently agitate the sample to make sure it's well mixed. Once I've done that, I'm going to release the depressor and attach this next piece. So this piece is a sample cup on the top and a little sieve portion on the bottom. This will strain out any of the fibrous material that's in the sample and keep just the liquid portion so that we can run the sample. Once this is done, I'm going to agitate it a little bit more, then take my filter here and put it on the top of the processing unit. This squeeze cup is special. It will allow me to press down while simultaneously sifting out the fibrous matter, and will leave the sample in the top of the cup. When I'm ready, I'm going to pour it into the filter at the top of the unit. And now the sample is ready to run. So while this is running, this takes about 2 minutes. I usually enter the patient information onto the iPad. When the patient information is entered in and the processing unit has finished running, I'll take the filter and place it onto the tray of the imaging unit and hit Analyze Sample. This will simultaneously capture the image to give the results, as well as uploading it into an email on the iPad. So when you get your fecal results in an email, you will see there are 3 components of the email. The first, giving you information as to what you're supposed to be deworming with, then any additional doctor's notes they may have to add, and a picture of the fecal result itself. The reason that we do fecal testing here is because we recommend strategic deworming, and this is due to help decrease the resistance to many of the dewormers, as well as treat the horses on an individual basis based upon their parasite load. The horses are grouped into 3 categories based upon how much parasite ova or eggs that they're shedding in their feces. These 3 classes are Class 1, Class 2, and Class 3, mild, moderate, and high shedders. So Class 1 horses will be dewormed twice a year. Class 2 category will be dewormed 3 times a year. And Class 3 or high shedders will be dewormed 4 times a year. For more information and a detailed guideline with a calendar for deworming, you can find that on our website, KBA Equine. If you're interested in submitting a fecal sample, if your horse hasn't been dewormed recently and is 3 years of age or older, we recommend that you submit a sample to your veterinarian at their next routine appointment or drop one off here at the clinic to be run.